Okay. There we go. Okay. So this is the form that they use. The first thing they do now, the way it is at Dr. Simcock's office, and this is because they've been doing it for so long, they have all their referring doctors on the same page and they just email the referrals to them. But because you're starting out, it may not be that way. You may have offices that are calling you, you may have patients that are calling you. So the goal over time is to get the referring office to just email you the routing slip, and you're just letting them know, and this is going to be a part of your marketing when you go into their office and just say, hey, we've got this great new way of referrals, and this is to save you time so that you don't have to call, and because we know you're busy, you're not going to have to call us. If you email us this routing slip or the referral slip, and you'll have your referral pad for them, just email it to us and we're going to call your patient that day.
So you don't have the office call to make sure you get that patient in?
No. No.
What if
And
it's like same day, or they don't do same day treatment?
no, they do same day treatment. So if there's an emergency, an office might call, like if
Okay.
the patient is in a lot of pain, obviously the office would call and be like, hey, I've got this patient, they're in a lot of
Okay.
pain. Then what we want to do in that case is we want to go, oh, absolutely, like give me the patient's information, I'm going to contact them right now. And then you get off the phone with the referring office. What we want to do is get the referring office off the phone as fast as possible. We want all of the information to come from the patient, because sometimes you'll get referring offices that call in and they're like, my patient's in a lot of pain. And then you talk to the patient's like, I'm not in any pain. You know what I mean?
That does happen.
Yeah. So the thing is like the referring office, they're not thinking the way you guys are thinking. They're just wanting to get their patient in. They're just wanting to make their patient feel taken care of. So when you work and you build the relationships with the referring offices that are sending you straightforward root canals, you can just go let them know, hey, this is our new referral slip. We've created this really great new way so that it takes you less time. Just email this to us and we're going to contact your patient that day. Now, there is a cutoff. Let's say they email it to you at 3 p.m., or 4 p.m. Just let them know. Then we'll contact them the next morning. But your patient will be contacted and we will take care of everything for you. That way you don't have to take the time out of your busy schedule to call us and go, give us any information, because we're going to get it all. So what the referring offices are doing with Dr. Simcock's office is they're emailing the referral slip and an x-ray. Then
And this is the referral slip?
no, this is the routing slip for your office. The referral slip would be the pad of paper that you give your referring offices. Yeah, that would be your referral. So they'll scan that in with the x-ray and they'll email that to their office. And then the whole front office has the same job. They see one come through, they print it out, they attach this paper, this routing slip to it, and they call the patient immediately. Okay, and this is, of course, when you have time, and this is why everybody does the same thing in the front, is because if one person is on the phone and you get something emailed, then the other person prints it out. And then in the email, they move it to a folder so that it shows it's been printed out. So you don't have a second person saying, oh, I need to print this out. It's gone from the inbox, if that makes sense.
How many front desks do Dr. Simcock have?
So he has Taylor, who's the front office scheduler. He has, I can't remember her name, I apologize. I don't live near them, so I'm not in their office ever. I'm just handling all of the training side of this, but they have the one who checks people out, but she still does the same thing. And then they have Travis, the office manager, and he does the same thing too. So it's basically 3 people that do the front office job.
Okay.
So, yeah, they're all doing that. And again, remember that as you guys are implementing changes, there's going to be some uproar. There's going to be some chaos. Like expect these things, but as you continually create the consistency with it, it will start to smooth out for you. So we're just going to take it step by step. But that's how they do it. So they'll call the patient. They use this form. They start here on the right-hand side. First, they fill this information out from the routing slip, like the date, the referring doctor, the name of the patient, the phone number, email, anything that they've provided on the routing slip for the patient, the tooth number, all that kind of stuff. So then what they do is they call the patient, and now they're wanting to find out from the patient what's going on. So they're, hey, how are you doing? This is Chrissy from North Sound Root Canal. We got a referral from Dr. Such and such. Just wanted you to tell me a little bit about what's going on. And then listen to them. Oh, my tooth, it's been throbbing every time I drink something, like it hurts really bad. And, let them talk, but then ask the questions that are trying to figure out what type of symptoms. Okay, you said that it hurts when you drink. Is it hurt when you drink something hot or cold? Oh, it's hot. And so when you drink something, does it linger? Does that pain linger for a long time? Yes. Does it hurt you to chew on that tooth? Yes. So what they're doing is they're circling the symptoms. And the way that Dr. Simcock has these laid out is if the patient exhibits 2 of these symptoms, that's an automatic root canal. Okay, so if you're circling 2 of the symptoms, and just because you've circled 2 symptoms doesn't mean you should stop asking the patient questions. Like ask them, does it hurt to bite on? Does it hurt if you drink something hot? Does it hurt if you drink something cold? Cold doesn't necessarily mean it's a root canal, but if it lingers for a long time after they drink something cold, that does. So those 2 symptoms together can indicate, but they still need to have either bite sensitivity. Do you have any swelling? Do you feel a bump? The fistula is the bump. Do you, have you?
I was just gonna ask what that was.
Yeah, the
It's also in
fistula is like
sinus tract.
the
Depending on-
fistula is like if you have an infection, it's like a pimple. And so if you have an infection, it's taking the point of least resistance and it's trying to get out of your body. So it'll form like a pimple or a lump inside of the gum next to the tooth. That's the pus trying to come out.
So we don't call that an abscess. That's different. Or it is the same thing.
They're
Well,
the same. An abscess is the tooth is infected and you can see it on the root canal.
For the
But a
X-ray.
fistula is an actual physical bump that pus is leaking out of. They can taste it.
that's where the infection is eating through the bone.
Yeah. And now it's coming out it's just like a pimple.
Nasty.
Yeah.
Mhm.
Yeah.
I've had one.
That's when we do. That's when we
Yeah.
do like an IND. If
Okay.
we do treatment or endo.
So if we ask that question, we would know that they need an IND.
Yeah.
Oh my gosh, that's good to know. Fistula.
Yeah, and not all of them need it, but it's good to quote for it, right? Because it's good to quote for something, let the patient know ahead of time, and then if
Vision
they don't
injury.
need it, then it's less money, right? So
But it's all different on the systems. They can be prepared.
Didn't even know that. Okay,
okay.
Learn
And then you
something.
ask, has there been any recent, no, you're right. Has there been any recent work done on this tooth? Oh yeah, I just 2 weeks ago, the dentist filled it, and then you're looking at an x-ray. If they've emailed you the x-ray, you can see on the x-ray how close the filling is to the pulp, right? And then here where it says GD mentioned, so on the routing slip or in the email, or maybe they called you, this is where you're going to put what they said. The GD meant you're just going to write here that the GD mentioned that they did a deep filling 2 weeks ago. The patient, the tooth is flared up. It's getting worse. So this is what you write, what they say. Okay. And then here, established or new, this is just, you've looked it up in the computer and you know if this patient has been an established patient with them or if it's a new patient. or actually that might be with the general dentist. I need to verify that one. But here is if this is a previous patient of yours, which doctor saw them, right? Circle the doctor that saw it, put here the tooth number that you did and when you did it. Because this is the information the doctor's going to want to know before he walks in the room, because, you know, that just helps him be able to communicate with the patient better. So right here, you have, oh, then you ask, has this tooth had a previous root canal on it before? Yes, it has, right? Let's say they say, yes, it has, or the general dentist says, yes, it has. Was it done by a specialist or a general dentist? If it was done by a general dentist, we want to find out when, but Dr. Simcox says if it was done by a general dentist, we just put it in for a retreatment, because we know that a general dentist is not going to do as good of a job as a specialist. If this is a root canal that was done by a specialist, then we are going to schedule it for an evaluation or a scan only appointment to find out, because we're always assuming that a specialist, we're going to give them the benefit of the doubt. And then by doing an evaluation or doing the scan only, that can show us, is it a tooth that's right next to it where they're feeling like it's that tooth? You know, that's where we can find out that information and not waste an appointment.
Good.
Okay. So then you're going to ask the patient, like, how do you do? Have you ever had a root canal before? So let's say they said, no, it hasn't had a previous root canal. You want to find out if this patient has had a root canal before. No, I haven't had a root canal, or yes, I have had a root canal. How did you do in the chair? Did you need to use, you know, how do you do in the dental chair when they're working on you? Do you feel normal? It's fine. Or do you get nervous? And they're going to tell you how they are. They're, oh, no, I can't. I have to have laughing gas. And I get so nervous that normally I take a Valium or whatever. If there's any anxiety at all, it's an automatic evaluation, because then the doctor is going to be able to evaluate whether this patient needs to be pre-medicated or anything like that. Okay. So anxiety is always going to be the evaluation. Are you on medications, antibiotics? So this whole thing here, we're gathering a story from the patient of what's going on. So once you've gathered all of this information, you're going to decide, is this going to be an evaluation or a consultation? Now, how do you guys do that right now? Do you eval every tooth first and then schedule them back for a root canal? Or do you schedule for root canal and evaluation on the same day? Same.
We try to do same day start on almost everybody. We would wait until we got the x-ray to kind of make that change.
Okay.
Or the patient says some key things like, well, I just have some questions, and I'm thinking consult only,
Yeah.
and I'm blocking a whole hour and a half. So
Yeah.
that's,
So
that
in
is,
those questions, we want to empower the front office staff, like write down a list of those questions and teach your front office how to answer those questions. Because a lot of times they're just going to need questions that you can answer for them. You don't always have to waste the doctor's time, because the doctor doesn't, I mean, we don't like to do consultations. We call them time wasters. You know,
yeah,
school to do root canals. And so if they fill their schedule with these low cost consultations, it's just, you know, it's a waste of everyone's time. So whatever we can do at the front office to answer the question, educate the patient, help them feel comfortable, then we just schedule them for treatment. So not to just automatically assume if they have questions that you can't answer them for them. You know, find out what those questions are. If they're questions you truly cannot answer, but they're exhibiting, like, let's say that they're, for sure, you've marked 3 symptoms. This is an absolute root canal, but they still don't want to come in for a root canal. They have questions for the doctor, questions you can't answer, questions they're not believing you. That's telling us this patient is possibly a little bit difficult. So we're going to schedule them out a couple weeks. And we're going to say, hey, okay, that's fine. We can get you in tomorrow at this time to do root canal treatment. But if you want to have an evaluation first, our next available is, and then just push it way out. and then give them the choice. And that way, if your doctor calls you, your referring doctor, let's say that patient is difficult, they might call their general dentist and be like, they're not getting me in until this time. Then you've looked on this paper and it shows that you have offered the next day root canal or the root canal that's 3 days out, but they didn't want to do that, so they chose the next available evaluation, which is this date. Then you're letting the doctor know, hey, we tried to get him in right away, they did not want to.
I
Right?
like that.
Mhm.
Oh my gosh,
I know, right?
So that's why this routing slip is so important, is you write everything on it. You know, if you feel it's a difficult patient, write down there, you know, hey, offered patient this appointment, they want an evaluation first. Because this is going to be scanned in, like when everything is said and done, this is going to be scanned into their chart in the computer, and you're going to have future information for this patient. Plus, if the referring office ever calls you, you have, and this is why everybody doing the same exact thing, they can look at this and see, oh yeah, it looks like they talked to such and such on this date, they offered them this appointment, they chose the evaluation.
Like it.
Any questions so far?
How do I get it on a smaller piece of paper?
Yeah.
Just kidding.
You can absolutely create your own, but again, remember this is folded in half, so it's just a half a sheet of paper.
Yes.
So, okay, so once you've
I'm messing.
gathered all, once you've gathered all the information, then you're going to decide what this patient needs. If they've got more than two or more of these symptoms, it's a root canal. As long as it hasn't had the previous root canal done by a specialist and they're not anxiety, we're going to schedule you for root canal treatment. Offer the next available root canal. Don't say what day works best for you. You know, we want to be in control of our schedule. Okay. So you just say our next available, you know, normally we're booked. You can even say like, normally we're booked out. Like if you're trying to fill today or tomorrow, you know, normally we're booked out, but we just had a cancellation. That's one thing you can say on this date, and they'll either take it or not. Okay, then our next available is this date at this time. And then just let them talk. Like, don't offer them a couple of appointments and let them choose. You're wanting to put them where you want them. Okay. And it doesn't mean we're rude to the patient. There's a way to do it and be very kind and let the patient feel like they're in complete control. You know, oh, normally we had this, you know, scheduled out 2 weeks, but we just had a cancellation tomorrow at 3 p.m. Would you like to come in then? Yes, you know, because that kind of creates a little bit of urgency in them, like, I don't want to wait 3 weeks, you know what I mean? So I'm going to take this appointment. So those are just kind of ways that you can talk to the patient. Always talk with a smile. We want to make the patient feel like they're royalty. So when we're talking with them, it's not, are you experiencing pain on the tooth when you bite on it? What about hot? And then they ask a question. Well, it just depends on what your insurance covers, and then you're responsible for the rest. Like, no, that doesn't feel good. If I call an office and they treat me that way, I'm not going to that office. You know what I mean? So
Yeah.
it's customer service, it's client care, it's knowing you're in control, but making them feel like they are, and just being super kind. A lot of people are nervous with root canals. They don't know what we know. They don't know what it entails. And so we want to help them feel like they're in the know. You know what I mean? So,
Yes.
so then you've decided what you're going to schedule for, you schedule it, then you ask for insurance information. Okay. You can also ask for the insurance, like let's say you know this is a root canal treatment. You can also ask for the insurance information before you schedule the appointment. You can get all this stuff beforehand, but you ask for their primary and their secondary insurance, then you can schedule it. You can schedule it before that, then ask for the primary and all that. Then you let them know, okay, so we've got you scheduled on this day. And just to let you know how things work, we will contact your insurance company to find out to get an estimate of what they will cover. Please know it is just an estimate because the insurance company does not tell us exactly what they'll cover. So all we can do is guess off of what they've covered in the past, things like that. But what we estimate them not to cover is due at the time of the appointment. So we do collect that before we do treatment. Okay. Then right there, they're gonna either up in arms and let you know, well, I can't, you know, I can't pay at the time of the appointment. Then you can say, you can offer all the care credit, you can offer a payment plan, you can do all that kind of stuff. If they still protest, then, you know, then don't schedule them. Because if you're not going to collect it at the time of the appointment, if they're going to be, you know, if they're not going to be able to pay at the time of the appointment, you're not going to collect that money. It's just, you know, some people will pay, some people won't. But if they're protesting up front, they're telling you right away, hey, I can't afford this, you know.
Great.
And okay, so then you hang up the phone, you've got them scheduled. Now, if they're scheduled for tomorrow, you're gonna contact the insurance company. And however you do that, whether you call or whether you look it up on the online, you're going to write all the information in here. So what percentage of root canals they cover, what percentage of fillings they cover, what is their deductible? Has the deductible been met? You circle met or not met. What is their maximum? What is, you can put what is pending if they show it, because then you're going to know you're going to want to deduct that from what their max is. What have they used so far? And what's their remaining balance? Okay, eval left, you can do that if you want, you can find out, but this is all the information that you want to gather. So then what we do is we decide based off of their symptoms. You know, here we write what their deductible is, the cost of the eval, the cost of the scan, the cost of the root canal, cost of the gentle wave, cost of a filling, whatever it is you think is going to be done. Like, and the only reason there's a filling here is if the general dentist is requesting it. Otherwise, Dr. Simcock doesn't do fillings. He doesn't do buildups. He doesn't do any of that stuff. He may put a composite over the gutta percha to prevent leakage, because if the patient doesn't go back to the general dentist right away, then that temporary filling is going to break down and the root canal is going to need to be retreated. So sometimes he'll do that just to kind of protect the tooth, but we're writing down what they're going to be charged for. Now, the way that we do it is we have, pull this aside. So Travis has kept track every time he gets an EOB in the mail. So the insurance is paid for a patient, and then that estimation of benefits tells you what they've paid. He keeps track of that. So what he does is he files away all of those EOBs he files them by the patient's last name. That way, if the patient calls in that year, they can pull it up and look to see what's been covered. But then at the end of the year, they take all of those EOBs out, they put them in order by insurance, and then they go through and they enter. They have this spreadsheet here, and they enter each one. So each EOB they go through, Aetna covered this much for an evaluation, this much for a molar. Like, this is what they paid the 80% off of, right? Aflac paid this much, Ameritise. So this is their spreadsheet that they go through, and they enter every single EOB. They do this every year at the end of the year. And then they compile this information and find the average of each one. Okay, so let's go back to Aetna. So here it looks like they're, they'll highlight to show, but it looks like they're covering 111. That seems to be the number that they're covering the most of. So then they go to their blue book under Aetna, under evaluation, and they type 111. So when you're figuring out, now they have this whole spreadsheet, what was covered the year before for this insurance company, because these are out of network insurance companies. In network, you know what they're going to cover because you're contracted with them, so you know. These are all out of network ones that I'm talking about. So don't keep the EOBs for the in network. Keep the EOBs for the out of network because this is going to show you what they're covering. So then once you get all of the information, I have to move my little thing down here everywhere. There we go. Once you get all of this information,
Software doesn't do it for him.
what's that?
He does that because the software doesn't do that for him?
I'm not sure.
I mean, I know
software do
TDO
that?
doesn't do it, but Open Dental does this.
Okay, they use PBS.
Pacific Dental, what is PDS?
PBS, it's just a different, it's
Okay,
just different software. It's very similar to TDO, but it's,
yeah, doesn't say it because it doesn't do it.
yeah. So, and this is just their way. So now they've gathered the information. They know what percentage of a root canal is going to be covered. And what they do is they don't charge separately for PAs, pulpal deprivement. I wanted to see how much. Real quickly, bear with me for just a second. So
Yeah. We'll heat them up, jeez. Runner.
is a pulpal deprivement, is that after he's accessed the tooth?
So that's like if we don't complete the treatment because it's a necrotic case, then we'll place medicine inside the tooth and then bring the patient back anywhere from like 8 to 16 weeks later.
Okay, does he do a lot of those?
He does.
Okay.
It's definitely decreased since we got the gentle wave, but there's still cases where we do that.
Okay, so I've added up the 2 PAs, the pulp vitality, because that's, I'm guessing he's testing that in the evaluation,
Yes,
and the consultation, and I have 208. That's the
Yes.
cost of those. So what we do is we charge the evaluation fee, the 0140, and I believe it's like, I need to verify this with them, but 250, and that includes everything. So you're not like nickel and diming the patient for all these things. It's just, this is the cost of the evaluation. It's 250. So whether you take 1 x-ray or 2 x-rays or 10 x-rays, it doesn't, it doesn't matter. We don't charge separately for that. And but I want to verify, let me write down these things that I need to verify from where's my note?
Does that mean they're not in network with anybody?
No, it's in network and out of network.
Huh, I'm curious how they do that because
When I was
but
well, when I was
Or just-
looking up the difference, go ahead.
sorry, I was just saying that the in-network one dictates to us what we can charge and what we can't. Procedure codes and everything.
Yes, the in-network tells you, but usually that code 0140, that's what most endodontists are using for the evaluation. And that just, it covers all of that stuff. So,
But it's less than what we charge for a specialty consult. I want to say it's like $98 with Delta, and it's 108 for the specialty consult. So that's our biggest contract. And so if we move to the limited exam, we'd be losing out on, $10 a patient.
I'm curious, can you look up what they cover for the code 0140?
Delta? Yeah,
Yeah.
I want to say it's $98. Oh, 90, even worse.
It's 0140, right?
Yes.
Okay.
So I wanna, yeah, I need to consult with Dr. Simcock on this one, because this is different. So don't change what you're doing yet. I'm just teaching you what we do here. And then we're gonna find what is gonna be the most efficient and best for you, the patient, and the general dentist, okay?
Yeah.
Okay, so what we do in this case is, let's say it's an out-of-network provider, then we consult this blue, and I can send you this as well. This is Washington State, and I don't know if it's different in, where are you guys located again? I've been working with so many.
Colorado.
Colorado. Okay, so I can send this to you and you can compare to some of the EOBs that you have. But know that the two states might be different. So then all we do is literally, and I know they don't do this at Dr. Simcox, but I want to tell you what we did at the office I worked at for years, is all evaluations we just collected in full at the time of the appointment. And the reason that we did that, and like I said, this is not something Dr. Simcock does, but the reason we did that is because we didn't know how many evaluations had been used. And it's just better to give a refund than it is to send a statement. So all evaluations were collected in full at the time of the appointment, and we just let them know that, you know, they would get a refund for whatever the insurance covered, if anything.
Yeah, we do need to change that. We haven't started doing that yet, but we do need to.
And honestly, we never, you know, these patients are coming to you, they're not like returning patients. So you're not going to get a lot of, if you're just letting them know and you're confident about it, they're not going to give you, you know, flack on it. They would if it was the root canal treatment, but you're going to figure out what they'll cover. So if it's out of network, you know, the insurance company will tell us how much, you know, what percentage they're going to cover. We'll consult this blue book, is what they call it. So for a molar, okay, so for a molar root canal, let's just say Aetna, they're going to cover, say, 80% in this patient's plan. But let's say they only have, you know, $300 left on their maximum. So we're literally going to subtract
that.
the 300. Yeah, we're going to subtract that. But when we're calculating off of these fees. So let's say they have a full benefits. We're going to calculate what 80% of $1,450 is. And then we're going to just subtract that amount from everything that's owed. And then that's what the patient is responsible for at the time of the appointment. Okay.
So who does that?
The front office, the scheduler. Usually, you know, when you start doing this and you're doing the same thing and it becomes consistent, it's going to start happening so fast. It's a lot faster than, you know, breaking out all these fees too, because you're just literally, you know, what's going to be charged, and you're only figuring out what they're going to, you know, if you charge for the consultation up front.
Yeah.
If you're just figuring out what they're going to pay for a root canal, you just use this. And if it's in network, you're just figuring out the root canal and they pay for the rest. And then you end up sending more refunds. That's what we want.
But you look at Mark. Oh, sorry. UPS guy just came walking in.
Oh. So that's our goal. So I'm going to send you all of these so that you guys can take a look at them and play around with them and figure out what works best for you.
Okay.
I was going to see when our next appointment with you and Dr. Soucie is. Do you know off the top of your head?
I don't think we have one scheduled.
We haven't scheduled our monthly meetings.
No. Cause I have my calendar.
Let me see. That's usually the first thing I do. All right, October. We need to get that scheduled. Okay. Did I send you an email that offered dates?
I don't think so.
Okay, I'll figure this out. I'll send you an email. What we normally do is, Dr. Simcock will let me know which Fridays he has available, and it's either gonna be the first Friday, third Friday, and it's gonna be that same Friday every month.
So it's a Friday every time.
Yes, normally a Friday. Sometimes he can do other days, but I'm not sure. So I'll have to check with him. What day works best for you guys?
Well, if we're gonna do it during the day, it'd be nice to do a Monday or Tuesday because we have our,
Always first thing in the
second-
morning appointments, just so you know.
it's fine.
Oh, okay. So
We have an endodontist in that day to see patients. So if we need to delay or do something, that's the best.
you said Monday or Tuesdays?
Mhm.
Okay.
Fridays are hard because it's just Dr. Soucie.
Oh, okay, yeah. And that's how it normally, just so you know, just with all of our other offices, they don't have a patient for that first hour. But I will let you know what I don't know.
I mean, I guess we could do Friday as long as I have it on the schedule ahead of time. That's fine.
And this would be the appointment with Dr. Soucie and you.
And Erica, you wanted to add
And Erica, yeah, yeah.
Mhm.
So, okay. So that's how we estimate. And then, like I said, I would like you to go to the module, watch the training on module 2, watch all the videos, but print out this efficient scheduling 101. It'll tell you to download it. And then this video training on this, where you print this out, it's going to go through this for you. It's going to go through this step by step. Okay.
Yep.
And so we have 4 types of appointments only. It's treatment, which is the evaluation, the scan, and treatment in one appointment, or we have an evaluation and scan, or we have a scan only appointment, or we have a well check. Those are the only 4 appointments that we offer. Okay. And it explains everything here in the workbook. This gives you an example of his typical day. And there's 2 time zones. There's the patient time zone and the doctor time zone. The doctor time zone is literally when you're looking at this schedule, the doctor walks into the room at 8 o'clock. And then he walks into the next room at 9 o'clock, right? Like if we're using this schedule as an example. So the patient time zone is them getting to the appointment a half an hour before time to make sure they don't have any questions, the paperwork is filled out, everything. So the assistant is there getting them ready so that the doctor can walk in at this time and the patient is ready to go. Okay.
Perfect.
Okay.
Sorry, the UPS guy was here. It has the door. It's like freezing and it's still snowing. And we are so cold.
You guys have snow already?
Oh my gosh. Well, my house like a foot. This is more like half a foot.
Gosh, I miss Colorado. I lived up in Gunnison, and
Oh,
the
yeah.
snow we got up there, I've never seen anything like it. It was pretty cool.
Yeah.
But the patient time zone, the doctor time zone is exactly what you see here. Doctor walks in, doctor walks in, doctor walks in. This is exactly what he's doing, and that's where the transitions are. And so he's going to talk with Dr. Simcock about transitions, and you guys are going to see that. That's between the dental assistants and the doctor. But like for this first patient, the dental assistant needs to be bringing this patient back at 7:40. Getting him ready so that when Dr. Soucie walks in at 8, the patient is ready to go.
So
Mhm.
we're very visual people here.
Mhm.
So that gives me anxiety.
Yes,
Because
everyone anxiety.
these appointments. Like, my schedule can't look like that. Cause in a quick instant, when somebody calls me, I'm like, I can't think fast enough to like add the extra time that we think they're supposed to be here and be able to switch on a dime like that.
Well, it's consistency. It's consistency. Like in this appointment, when you schedule this patient's appointment, you're
Uh-huh.
telling them their time is 7:30, not 8 o'clock. You're to be here at 7:30. You know, that's the time of your appointment. You're not saying, I'm scheduling you for 8 o'clock. But we need you here at 7:30 because they will never come on time. You let them know their appointment is at 7:30 because we want them to get there and we want that dental assistant to be bringing them back.
So it's always a half an hour before what
Yes.
shows on the schedule.
Yep.
Okay.
Okay.
It's only a half an hour. I can do that math.
And
Yeah, it's just 30 minutes and they shouldn't be waiting in the waiting room. The assistant brings them back and they start that way they have the time to treat this patient again like royalty. I'm looking down here because your picture is down in the corner. Sorry.
That's okay.
They're treating them like royalty. They're bringing them back. They're doing the scan. They're asking their symptoms. They're getting them ready. They're getting everything ready. If they need to leave the room, they let the patient know, hey, I'm going to be walking in and out, but I'm going to be checking on you. Doctor's going to be in real soon. Do you have any, constantly asking the patient, do you have any questions? So that all questions can be answered before the doctor goes in. Because the whole purpose is we want the doctor to walk in here, say, hey, how's it going to the patient, introduce himself and say, well, it looks like this tooth is flared up. It looks like this. He does a couple little tests and says, okay, we're going to go ahead and get you numb. And then boom, he's numbing. Like it's not him doing the full thing because he already has all of this information. He's looking at the x-ray and then he's able to just go straight into what he's supposed to do.
Okay, so they have 30 minutes. Got it. And
Yeah.
then they send post-op instructions and things at that point? Like get everything ready?
The dental assistant does everything. So when the doctor transitions out of the room, so usually so the assistant at Dr. Simcock's office holds the gentle wave wand. So
Yes.
once they start holding it, Dr. Simcock transitions to the next patient that's already ready for them, introduces himself, gets them numb. Once they're numb, he goes back and transitions to that first patient. Says, because the check film is already, or he fills, right? He does the filling. Then, then they do the check film and everything, and then he's done. And then the dental assistant gives all the post-op information at the end of the appointment. Okay. So as she's getting them cleared up, how did it go? The tooth looks great. We don't say, now you may experience, some really difficulty in this tooth. We don't want to give the patient anything to mentally focus on as far as pain and discomfort. We don't want to bring back patients for rechecks all the time. We want to trust that the technology is work and the root canals work, and that if the patient is having issues, that they're going to call us and let us know. Right? So just, you can take ibuprofen for the next couple days and give all the post-op instructions and then send them up to get checked out. And then the assistant goes back, cleans their room, gets ready for the next patient, marks the schedule, and they're done. They're ready for the next patient.
Okay.
Okay. And remember, you don't have to memorize all this right now, but this is where we're heading, the direction we're heading. Okay. So
with the intake information, so
Yeah.
the 30 minutes is just for the assistant to go over their symptoms, go over their health history, take whatever PAs they need, and the scan.
Yes.
Okay.
So you tell the patient, so the patient's appointment's at 8 o'clock in the computer. You let them know, okay, your appointment's at 7:30. And if you have the capability to have them fill things out online, then let them know that. But if they don't fill things out online, then they have time to fill it out once they get to the appointment. So that gives the patient time to fill out all of your information. And then there is a specific time that the dental assistant will take the patient back. Even if they're not done with the paperwork, the assistant can help them along with the paperwork. Like, let's say it's an older person and they're a little bit slower. The assistant can ask the questions, do the markings, like can do a lot of things to help the patient. But they would bring them back, get the scan, and then help them out while they're in the chair. Once they've signed everything, then they can take that information up to the front office and then finish their appointment. Or they can go out, because the purpose of this also is that we're not having multiple people in the waiting room. They can help them in the waiting room as well.
Okay.
Yeah, and then
And then,
I'm sorry, go ahead.
Finish filling out paperwork in the back.
mhm.
That's.
And then how many assistants are working with the doctor for that schedule?
For that schedule, the optimum is the best is 3 dental assistants. Right now, he's working with 2 because they're looking for another one. One of them had left. But 3 dental assistants for that schedule is optimal. And that way too, if anyone's sick, if there's a dental assistant that's ever sick, the 2 people can handle it for a day or 2. But it's not, but to just have 2 dental assistants for that schedule all the time, that's gonna wear them out.
Mhm.
So 3 is perfect.
Okay.
Okay. So yeah, so that appointment time, you know, you're in the computer, it says the one thing, because that's doctor time only. We want the doctor to be able to look at that schedule and know exactly where he's supposed to be and when. That's the purpose of that schedule, is to help the doctor. So we just need to add that half an hour and tell the patient the appointment is a half an hour earlier, okay? All right, so where did it go? Okay. Then this takes you through, and again, watch the training, but this is his referral slip. This is what gets emailed, like he's taking this to the office. This gets emailed along with the x-ray, and this is how, so you can customize yours however you want. Then we go into, this is the phone triage. So if you're struggling with phone triage, this is a really good tool to help you. And I'm going to make this bigger because my eyesight is okay. So when a patient calls, you know, if a patient calls you, you ask them, have you had a prior root canal? Yes. Then you move to the right here. Are you feeling hot and cold sensitivity? Yes. This indicates it's a different tooth, and we would probably do an evaluation first.
I learned that from Erica.
If they said no to hot and cold sensitivity, we move down. Was this prior root canal done by our office within the first 2 years? If they said yes, we'd move to the right here with a green check, schedule the patient for a well check, and assess if antibiotics are needed and monitoring the healing. If they said no, we'd move down to this one. Has this prior endo been done by a general dentist? If they said yes, then that tells you to gather the symptoms and a PA and review with the doctor about how they would like to schedule. So this would probably be a scan only appointment. A scan only, have we talked to you about scan only appointments?
No.
Okay, scan only appointments are appointments that the patient comes in and we just do the scan and gather all of the information, and then the doctor reviews it when he has time in the day or at the end of the evening, and then he lets the assistant know how to schedule the appointment. Okay.
Okay.
And that helps if you get too bogged up with evaluations, allowing people to come in, like they're not seeing the doctor at all, making sure they know, okay, you're not going to see the doctor, but this is a way we can get you in soon so we can address what's happening. It also helps with referring dentists. If you're scheduled way far out for your evaluations and that's not making them happy, you can offer a scan only appointment. Dr. Simcock does scan only days. So they'll have just the assistants working, taking the patients back, doing the scans, collecting the symptoms, and then letting the patient know we're going to give you a call.
And collecting the symptoms is just verbally speaking to them.
Yes.
Not testing the tooth, right?
I think there are some tests that they can do, but only the ones that they're allowed. And that's something that Dr. Simcock can, we can talk about that in the meeting. All right, I was gonna verify. Oh, the evals. And scan only, testing. Okay, so if they said no, then we assume the endodontist did a good job and we would schedule it for an evaluation. This is for a tooth that has had a root canal. If it has not had a prior root canal, then you go straight into the symptoms. And this is directly on that routing slip that I talked to you about. Is it hot and cold sensitive? Does it hurt to biting? All that kind of stuff. What did the general dentist say about it? And this form right here will
Doing that today. We're like, this is beautiful.
So this is really nice. If it hasn't had a root canal, you move down this way. If it has had a root canal, you kind of move to the right and go according to the yes or the no's, okay? So this is a very helpful tool. Once you change, you know, and you can start to apply this right away. These
Yes.
you can apply the routing slip and you can apply this even before you change your schedule, and you can start to see how it works. You can start to see, is the doctor waiting around? Like, just making sure that you're scheduling for the correct appointment.
I like it.
As we go down, this is the sample of the routing slip, which you'll be able to download it. But it describes to you, you know, here it tells you everything. Before the call, it tells you what to do before the call. It tells you what to do in the call process right here. So everything we've just kind of talked about, this reinforces it, answers questions, you take down all the information. And then there's the reminder call. So it talks about the confirmation. Now, one thing I forgot to tell you is, let's say you've scheduled your patient, but the next available root canal appointment is 2 weeks. Let's just say that it's 2 weeks out, or that's the only time they're available to do it because they have to take time off of work. You let them know, we're going to call you like a week to 3 days before. That's when you would check the insurance company. So you wouldn't check it like right then. What I would do is I'd have the routing slip with their information on it. And this routing slip, once it's printed out, and maybe we've talked to the patient, but the phone started ringing again, this routing slip with all the information is going to go in a pile on the desk. And whoever has time, like the phone rings again, you're on the phone. If somebody else has downtime, they're going to pick this up and they're going to pick up where you left off. Okay, so that way everybody's doing the same thing. Nobody's sitting around. Nobody's getting a collection of these like piled up and they feel overwhelmed. You know what I mean? So that's the team mentality. It's like, hey, we've got the central location. Whoever has downtime is going to grab one of these. Now, if you can get one of those slot holders, and you can have need to call insurance, and you can put it in the need to call insurance, but you're going to want to look at when the appointment is. If the appointment is 2 weeks out, you want to wait until you're closer to the appointment to call that insurance company in like 4 days. And then you call the patient to let them know, okay, we spoke with your insurance company. This is what's going to be due at the time of the appointment. Do you have any questions? So, and then as you guys get more efficient, you're not going to be scheduled out more than, we're hoping no more than 2 days. So you're just going to be doing all of it all at the same time. And that might sound like you have anxiety because you're like, oh my gosh, we haven't had, but the point is now we have time to get all of our favorite referring offices in very quickly, and that makes them happy. Okay, so then this addresses objections. If the patients have objections about money, if the patients have objections about the time and how it doesn't work for them, I don't think I need treatment. Like this kind of takes you through how to handle those type of objections. I don't want whatever the gentle wave thing is. And this tells you what we do in our office and how we explain it to the patient. Then we go over out of network. By the way, if it's out of network for the root canal and you don't have that estimation of what you think they're going to cover, what we do is we subtract $300 from the cost of our root canal. And then we estimate off of that amount. Then you add the $300, then you add the $300 back in at the end. Does that make sense?
You mean 200? It says 200 there. Is that?
Well, it needs to change to 300 because they're doing 300 now. So
Okay.
thank you for pointing that out. I need to change this, but increase the root canal treatment fee by and it
So
says
you decrease it by 300, do the percentage on that,
yes,
and then put it back in.
yes.
Okay.
Actually, this is just for gentle wave. Because this is the gentle wave portion. This isn't for the root canal. But yes,
Okay.
you know, to estimate something that you have no clue, you don't work with this insurance company, you have no clue what they've paid in the past, then you would just decrease your fee by $300, estimate off of that, and then take that and subtract it from the actual cost of your root canal, which is like adding the 300 back in. Does that make sense?
Yes.
Okay. And then don't be afraid to dismiss, you know. So you want patients that are going to be working with you. You want, and that referral, we've gone over the referral tracking, correct?
Yes.
Have you been filling those out monthly?
No, I forgot how to do it, and then we had Aiden start, and I was gonna have him help me, so we pulled up. I couldn't show him how to do it. We had to get the referral, the video out that you had sent me, and we played it. And then I was like, oh, okay, this is how we do it. And then he got busy, and he hasn't helped me, and I haven't had time.
Okay, so that's important because that's going to tell you, like, you know, if you have a patient that's being difficult, but it's one of these like really freaking amazing referrals,
You're gonna take it.
you handle it differently. Yeah. So
Yeah.
it's also going to show you which doctors to start marketing to and things like that. So that is,
I know.
and that is also something that we are going to be looking at before our monthly appointments, because we're going to discuss that, and we're going to discuss the daily tracker, which I need to train you on that next.
And Travis does all this.
Mhm. Yes. And it is really, you know, it seems like it's a lot, but it's you can delegate someone to do that. That can be their task for the referral tracker, to have them print the report. It's once a month, and enter that information. For the daily tracker, we got to get your schedule changed. We've got to start implementing these things in order to start tracking, but this is what helps us know how to help you guys.
Yeah.
So we need to have these up to date. Because for the program, we want to make sure you're getting literally everything you can and more out of it. So
Well, for scheduling wise, this has helped, because right now it's like, how do we teach Kimmy faster, right? But the way you have this laid out is clearer than what we've been trying to show her.
yeah.
So
So
that
print-
helped.
print the
Now she
scheduling.
can be on her own.
Pull up this module. This is module number 2. It's efficient scheduling. In this efficient, like you can see right here, this is the routing slip that I showed you. Download that, download the call screening process, download the intake form, and this is patient forms. You don't have to use these, but this is what Dr. Simcock gives his patients to fill out. So you can look and you can either customize yours, because some of the offices we've worked at have like a stack of forms for these patients to fill out.
Seriously, we do.
Okay, so you can
It's
look
bad.
to see, yeah, you can look to see here what he uses, and then you can start to make it work for you. You know, take what works for you, leave what doesn't.
Read half the stuff that they type in there. Like, I know they don't read it because I don't even know where to find it, but it takes them 20 minutes to fill it out, and nobody looks at it.
Yeah, so then we just want to condense it and make sure they're just
You know.
signing the most important papers, you know? HIPAA and the medical consents, like those kind of things, the most important things.
Yes.
This video here is going to go over this efficient scheduling for you. So watch, this is how you can, if you hire somebody new, this is, you pull this up, have them watch this, print this out, the efficient scheduling 101. I personally, because I'm such a visual person and I'm tactile, I send mine to Office Depot and have them spiral print it, print a couple of them, and that way you have the, you know, each person has a book. So yeah, or you can print it black and white. I don't like black and white. I like the colors. I like to see things, but you can have these spiral printed from Office Depot, or you know, and have them in your office. If you hire somebody, or maybe someone you're noticing is struggling, have them rewatch this and go through the manual again. So it's a really good training resource.
Can we edit it if we need to modify it to our?
It's a PDF, so you can't edit it, but you're more than welcome to take whatever it is and create your own.
Okay.
Yeah, I didn't create it in Word, so it's not editable.
Got it.
Otherwise, I'd send you the Word document and you could edit it, but it's not, so it's just PDF form. All right, so do you have any questions?
I don't. I think there's some things that we need to change. But that won't be hard, so
Yeah, just
it'll be
step,
easier for Kimmy because she's new, so she
yeah,
doesn't
so
know
she's gonna be
it.
learning like right off the bat. It's not gonna have to be like changing like something that's already solidified. So yeah, print those out, watch the video, and just start to implement the scheduling, because you can do that now. You don't have to change your schedule to implement it. I mean, you don't want to tell the patient to come in a half an hour early if you're still using your schedule template, right? So that's the only thing. Once we change the schedule to look like the schedule template that fits for Dr. Soucie, that's when we'll implement the 30 minutes. But everything else is going to be helpful for you. And the purpose is just making sure we're scheduling for treatment if it needs treatment, evaluation if it needs evaluation, and scan only if you're just not sure, or the patient just, you know, it's scheduled, because we're coming to the end of the year also. So people are going to want to be getting their benefits used. So if you don't know if it's a root canal and they don't want to wait, they want to use their benefits, you can bring them in for a scan only appointment and then let Dr. Soucie let you know. And that way you can get them scheduled for treatment before the end of the year.
Like it.
Okay.
Do that right away.
All right. Okay, so the next thing that we're going to do is I'm going to get dates for our monthly meeting, and we're going to have our next meeting. We're going to have that every month. The next thing that we're going to train on is most likely the schedule template, and then we're going to get into the daily tracking of the collections and production.
You need the whole team for the scheduling, like the assistants as well? Like, would that be?
No, the doctor's meetings, this is really just going to be the leaders implementing these things.
I was talking about the scheduling one, when we do that one.
Oh, no. Because we're basically doing the scheduling right here. It's
Okay.
just when you change your schedule to look like that template.
Got it. Okay.
Okay. And yeah, and I'm gonna verify some of these other things with Travis, some of the questions that I have. And yeah, we're gonna go from there. And if you have any questions, again, don't hesitate to reach out. Hopefully things in my life will start to like I'm
Seriously.
done. I'm like, I could use a break now. So
Yeah,
I just
seriously.
want to work. Just let me work. But okay. All right. So yeah, if you have any questions, let me know.
Erica might have a question.
Yeah, go ahead.
So we scheduled our meeting or our time to come out to see Dr. Simcox's office. So what will that kind of look like? That
So, I'm sorry, did I cut you off?
well, no, I kind of just didn't really know what else I was asking. I just kind of want to gain like idea of when we're there that day, what that would look like for us to gain
Yeah.
knowledge that we need to.
So most likely it's just going to be the team leads, because he has a very small office, so that he can't like accommodate a bunch of people. And the dental assistant leader is gonna be in the back, watching how things work in the back. Carrie, you're gonna kind of shadow Travis, watching everything and, make sure you bring your notepad, you can ask questions. And then the front office scheduler is gonna be shadowing the front office.
We didn't bring the front office scheduler because we don't really have one, but we
Okay,
did
that's fine.
bring, and we brought an assistant, our longest, our oldest, no. How do I say that correctly? The assistant has been with Dr. Soucie the longest.
Okay.
And, well, he really values her, obviously all of them, but, she's coming, so the four of us.
I'm gonna stop the recording here real quick because we don't need